Saline lock. Saline locks are useful devices that provide access for medications or substrates where large amounts of fluid are not required and therefore an IV tubing set and normal saline fluid bag are not attached. Saline locks also allow for easier movement of the patient without the risk of dislodging or displacing the IV access by snagging the IV tubing on other objects. For this skill, you will require a vial or nebule of injectable normal saline, a 10 cc syringe and blunt access needle, a saline lock or connector, an appropriate sized catheter over needle, alcohol swabs, op-site, tape, 2x2 gauze square, and a tourniquet. Prime a 10 cc syringe or prepare a preloaded saline syringe. Using the saline-filled syringe, attach and prime the saline lock, then set aside. Initiate an IV, starting with the application of the tourniquet. Open and set aside the op-site, the 2x2 gauze square, tape, and alcohol swab. Identify and cleanse the site you wish to access using an alcohol swab, wiping in an inward-outward circular motion. Insert the IV catheter over needle until blood flash is seen in the hub. Lower your angle and then advance a few more millimeters to ensure the catheter is in the vein. Depending on the SafeSharps catheters your system uses, retract the needle as you advance the catheter into the vein. Once the catheter is seated, leave the needle housing attached to the hub while you apply the op-site over the hub and IV site. A 2x2 gauze square is positioned under the hub to absorb blood leakage when exchanging the needle housing for the saline lock. Occlude the end of the catheter with one finger while steadying the hub with the thumb and forefinger of one hand. With your other hand, remove the needle housing and replace with the luer lock end of the saline lock and secure the lock to the hub. Once in place, line patency is assessed by infusing the saline from the syringe while observing the IV site for signs of swelling, resistance, or redness suggesting that the line is interstitial. As you complete the infusion, use the slide clamp to close off the saline lock prior to removing the syringe. This helps to eliminate backflow of blood into the lock and ensure patency. Complete the procedure by securing the lock in place, leaving the connector site accessible for attaching IV tubing or a needleless syringe.